This is a Knowledge Network presentation.
So no vehicles here?
No vehicles, no, it's all ATVs.
Many of you will be familiar with the name Hartley Bay. It's the remote First Nations community that was thrust into the media spotlight on March 22, 2006. That's when the BC ferry Queen of the North sank in these waters.
When you wake up in the morning and it's 7:45, you hurry to get ready, you don't want to be late, you brush your teeth.
It was the parents and relatives of these children that saved lives that terrible night. And now they're saving their own children by tackling a serious health issue: tooth decay.
Caries is in fact the commonest infectious disease involving children worldwide. It's caused by a streptococcus attacking the teeth. And the long-term consequences of that inflammation persist into adult life, in that poor oral health is linked to heart disease, diabetes, and premature labor and stroke in adults.
The more you brush, the more the tooth bugs can't get on.
Dr. Andrew McNabb is a professor of pediatrics at the University of British Columbia. For the past 4 years, he's been collaborating with the Hartley Bay community to improve healthcare.
The commonest reason for a child having a general anesthetic in British Columbia is to have major dental work done.
Okay, everybody, get the brushing and flossing over with. Let's go.
Cam Hill is a teacher in Hartley Bay. When he was a student, there were no toothbrushes in the classroom, just tooth decay.
We never really had to worry about brushing and flossing due to our diet. Our diet has changed so much over the last 100 years, but with the introduction of no way around it, junk food, pop, sweets, things that weren't a natural diet for us here, really impacted our teeth and our overall health for that matter.
If you think it's tough getting a dentist or doctor's appointment, try living in Hartley Bay. The town is very small, about 200 people, and that number doesn't include a dentist or doctor. Robert Robinson is the community health representative.
Even with some of the doctors we deal with now, they don't understand our isolation. Like for Prince Rupert, for example, most of the doctors think we can just hop in our cars and go to the store and get whatever we need. They don't understand that we're 80, 85 miles away from any nearest major centers. And unfortunately, the only stores that survive here in the community are junk food stores.
Robinson takes me to the only B&B in town, where I meet David Benton, the co-proprietor.
Prior to us commencing this program, there were 4 children who had no cavities in their mouth. Now, that doesn't mean they didn't have fillings, but they had no active cavities, 4 out of 58.
As the former health director here, Benton was frustrated with the challenges posed by location. He seized the opportunity to work with Andrew McNabb and the village elders to initiate what they called the Brighter Smiles program. They initially focused on improving the kids' oral health care.
Every lunchtime, the children are supervised brushing their teeth, and then they have regular applications of fluoride. The younger children a fluoride varnish, and the older children a fluoride rinse to strengthen their teeth. And there is flossing practiced as well.
It made a difference to have our kids brushing and flossing in the morning when they'd come in the school, and also right after lunch. And the school and the staff and the community were dedicated to making sure that they allotted the time for the kids to do that.
After 3 years, the kids' teeth have improved fourfold, from 8% to 32% cavity-free on last check.
There is something about the mix of the community and the commitment of the community which has made it the first program to achieve a sustained reduction in the incidence of caries in Aboriginal children in North America.
Hi, Brandon. How are you doing? My name's Kevin.
Brighter Smiles has expanded beyond dental to providing other healthcare services for the kids. There are no shortages of doctors in Hartley Bay now. Interns from the UBC Pediatric Residency Program visit quarterly to conduct well child clinics.
We've improved their immunization rates after inquiries about that. We've helped them address nutrition issues, and most recently we have conducted a screening program for them to look at the incidence of diabetes or impaired glucose tolerance in all their children.
And here's the twist that makes the program really interesting and probably accounts for its success. The program is collaborative. It's not just the kids that benefit.
We benefit tremendously because we get exposed to the community. We get exposed to the Aboriginal health issues that are specific to this community, but are also broader to the Aboriginal population and Aboriginal children. And we get exposed to smaller communities and maybe different types of communities than we'd be exposed to in our own personal experience or than we're exposed to when we're working at Children's Hospital.
It's really important for me to understand that there's so many children that we see that are outside of Vancouver and that live in communities like this. And so this trip for me, the most important thing was to learn what sorts of lives that they live out here, what resources they have, and what a normal day is for them and what their issues are.
And now, Brighter Smiles has gone international. It's become a model for a program in Uganda.
A university in Africa heard about the success that the Hartley Bay community had with their oral health program, and really in establishing what is in effect a health promoting school, a school which focuses regularly on health issues. And they asked us if we would translate the program to Africa for them to use in their own Aboriginal community.
Brighter Smiles Uganda is running in 4 communities with over 1,000 children enrolled.
1, 2, 3.
These 7 students from the University of British Columbia will be going to Uganda in the summer as volunteers for the program. But first, they're making a stopover in Hartley Bay to get some valuable experience. The children here are teaching them what they've learned about oral health care. And here's what our experts have to say about why you need to take care of your pearly whites.
Have a better smile.
So you can get a healthy looking smile and pearly whites.
So they won't fall out, and so we could have a bright smile.
1, 2, 3, bright smile.